Hi, I'm Dr. Opdahl. Let me explain to you the most common cause of low back problems. There's two things that cause low back problems. One is major trauma, the other one is minor trauma. A major trauma would be like an auto accident injury, a sports injury, childhood traumas that were not properly taken care of with physical medicine. These can fester and then show up later on in life as a real problem. The second is called minor repetitive traumas. Now, these are things like if you have a really physical job that's abusive, a lot of heavy lifting, twisting, things like that. The other one is if you sit all day, that puts a lot of pressure on those discs and the different joints in the lower back and can lead to low back pain. So the cause of the low back pain is inside either the disc, there's three parts, there's a disc, or there's tiny facets in the back. These are joints, the plates that line up. Those can get jammed and they are really sensitive. I mean, if they're fully functional, they feel great, but the minute you start to jam or pinch or irritate one of those, they hurt really bad. That's the sharp stabbing pain you get, is in those facets. The disc causes an achiness until it starts to either herniate or bulge or rupture. Rupture is called a sequestration. So a bulge is when it starts to push out. A herniation is when it actually pops and leaks fluid, and then a sequestration is when it leaks so much fluid it fills up all around the nerve, and that's excruciating. So, and then the nerve is the third thing. So we've got a disc, a facet, or a pinched nerve. And that's when the nerve starts to get irritated because of something that's going on around the disc or the facet. So these are the three things that can cause pain in the lower back. When any one of those things goes wrong, the first thing that's going to happen is usually you have pain. You're always going to have some stiffness, lack of movement, achiness in there. The joints won't move properly. And then the third thing is the muscles are going to lock down really tight. They're going to try and protect that area. And also they hurt. They become achy, sore, stiff. I can't believe how many people come in and say, I pulled a muscle, when it's actually just they injure the joint and the muscles are so tight all the time it feels like they have a pulled muscle. So these things are really painful. The last thing is if you pinch a nerve badly enough from all of this damage in the low back, it can actually cause numbness, tingling, and radiating pain to wherever it's going, usually down the leg or into the groin or something like that. So if you've got any of these symptoms, if you have any type of a problem like this, I have a very high success rate in dealing with these types of problems. Give me a call, 360-666-6001.